like to welcome you here today. We're grateful to have some people here from us. I'm Daryl Seymore, Navajo County. And with us, we have Dr. Galhotra from the Summit Hospital, as well as Ed Mutter with the city manager of City of Shoalo. Welcome. Doctor, why don't you just tell us, introduce yourself, tell us a little bit how long you've been with Summit and just how well you enjoy the community and kind of a little bit of your background.
Okay, yes, sir. Thank you. So I'm Simran Galhotra. I'm a lung doctor, a critical care doctor. I'm also a sleep doctor. I've been in the community full-time since August of 2008. I moved here. My whole family here. My kids have gone through Blue Ridge High School, through Blue Ridge, and now on to college. I was employed by Summit Healthcare on October 2013, and I've been the ICU medical director, director of cardiopulmonary services, and many other things since then, as well as in the physician leadership. So since this whole COVID-19 pandemic started, I've been very heavily involved in coming up with the protocol to treat patients in the inpatient in the hospital, and I'm still doing that.
That's great. We'll appreciate it. Mr. Mutter, how have you felt through this through COVID-19? Kind of stayed a little bit. You and I know each other, and I'm sure the public knows you, but just share a little bit about some of the things that have gone on with maybe your personal life, feelings that you have about COVID and some of the things going forward.
Okay, since early 2020, when this thing started hitting our area, myself, I've been very concerned with the COVID-19, and the whole world, our community, the nation prayed and hoped that we'd find some cure or something to help, a remedy for the COVID-19. And I think we have that with the vaccine. I think it certainly can help slow the spread. And so I've been supportive of it since it came out.
Well, I myself have probably taken a little different role. I'm totally for people of choice. I'm totally for, I think sometimes we have a lot of thought that we're made to do things, and so we push back. But when you look at it, and when you look at the protocols that have been put in place with social distancing, with wearing a mask, within a vaccination, and the seriousness of it, and being able to work directly with our public health director and see the numbers that come in, to see what really happened with people's lives and the choices that we have to make. They're not easy choices. They're not easy choices to lead and to say this is something that we feel will make a difference or will be able to help you. But when we start seeing statistics to start backing up the things and choices that are in place and those things that are available, then that's where it starts to change, and it starts to make a difference in personal lives. And I'll get into that a little later as to why maybe opinions change or why as we go through it. But I think really today we'd like to share, have Dr. share with us your opinion about the vaccine. There's been good and bad and everything that comes from it. I will say that maybe our messaging, maybe the direction, there's as much people don't go to sources as much for their information as they trust their friends who know sometimes nothing about a matter, but they heard something, and right. Social media becomes the scientific expert when really we have people who see and work with it and have the understanding. Why don't you just share a little bit about your understanding of the vaccine and also of the illness that's out there?
Okay, well, thank you. So the vaccines, the technology, mRNA technology that is the basis of the Pfizer as well as the Moderna vaccines, actually started around 2003 or so, when the first SARS coronavirus 2 came out. So this isn't, one of the criticisms of these two vaccines is that they're too new. Well, the truth is that the underlying technology is actually 17, 18 years old. And it was just astounding how rapidly the vaccines were developed from the time that the effort started back in February or so, January, February of 2020. And all throughout that time, as I was taking care of patients in the intensive care unit that are extremely sick. I mean, this is a horrendous disease. For most people, it's like a bit of a cold, but for a vulnerable population, it can be devastating. It affects all the systems of the body. I would, since late March of 2020, I've spent the vast majority of my time taking care of patients with COVID. And back then, March 2020, we didn't have a vaccine. We've had vaccines available now, and they're actually very effective. I got vaccinated immediately when it was available to me in December. The overall statistics of the safety of specifically these two vaccines is extremely that they're extremely safe. Yes, you may have some bad outcomes in 1 out of a million people, 100,000, 200,000 people, something like that. But the safety that it provides you, the protection that it provides you, the vaccine provides you from getting severe disease and dying is definitely proven. There's no contest. There's no, argument about that. Now, I don't believe in vaccine mandate. I believe that people should be able to make up their own mind as to what's safe for them. But when I go into the intensive care unit and I have 18 patients who have COVID and none of them have been vaccinated, there's a message there. The message is that if you do get vaccinated, you might not end up in my ICU and I'm sorry, die, because that is the risk. So it's not a hoax. COVID isn't a hoax. It's real. I take care of folks every day with this nasty disease, and we have a way to make it less nasty by taking the vaccine.
That's fantastic. I look at it kind of like an Indy 500 race. Okay, everybody's going to go out there. They're going to be in the race, and they all have the fastest cars that they have.
Right.
But there's always safety precautions that each of those drivers are asked to follow. Sure. And they can be experts in their field, experts doing it. But I'll guarantee you that sometime in that race, there's going to be a crash, and there's going to be somebody that's going to be affected. And if the worst case scenario happens, there could be several people crash and several people actually die. Then it does not just affect the drivers or the team, it affects life and everything through it. As I went through COVID a little bit, I got to have a time when my sister was in the hospital. My mother, who's 93, has been in the hospital twice. I have my stepfather who is in the hospital who didn't die from COVID, but he wasn't able to receive maybe the same care that he could have had the hospital not had some of the challenges that it had at the time. So I found myself in a compromising situation of going into those facilities or not being able to go in as a result of COVID. And as I started looking at it, I realized that myself, I'm a kidney transplant patient, so I have a immune deficiency as it is. And so that's suppressed. And I said, what can I do to make it where I am safer once I leave or once I'm in those places, that I may not pass something on to somebody else, and trying to stay as healthy as I can. So I looked at it as an opportunity to make myself better, stronger, and have a better defense against something that could ultimately change the life of somebody that I came in contact with for a negative fact. And so that was by my decision of why I chose, and I got vaccinated on April the 4th of this past April. So as it was available. So I took the Johnson & Johnson vaccine. So it's a little different, and maybe you can get into why that vaccine is different from the other two.
Well, the technology is just a little bit different. Overall, the protection is good from the Johnson & Johnson vaccine. I have seen a handful of patients in the hospital who have been fully vaccinated. Well, got the one Johnson Johnson shot. They weren't quite as sick as the other ones who got no vaccine. If you ask me a preference, I would say the Pfizer or the Moderna would be more suitable. Would be better. And in fact, you can still get a booster from one of the others to in your own personal situation. My decision was quite easy. I'm in the midst of COVID all the time, and I don't want to bring it home to my family and give it to my wife or anybody else. So, or to patients or other caregivers, other healthcare providers.
Mr. Mutter, do you want to share?
I'm similar to you two. I just don't want to be responsible for spreading it to somebody else. I meet with a lot of people. I have family, I have in-laws, and my mother in their 80s, and that's why I got the vaccine as soon as I could, because I didn't want to be responsible for spreading it to somebody else. I know a number of people that have passed away from the COVID disease, and unfortunately, most of them, probably all of them, weren't vaccinated. Some of them passed away before the vaccine was available. But just basically, I just don't want to be responsible for spreading the disease.
What are you seeing with this Delta variant? Okay, as the topic now is, okay, we have a Delta variant. Talk a little bit on the Delta variant and also the difference now that these vaccines have been FDA approved.
Okay, so the Delta variant became prevalent here became the most widely circulated type probably 3 months ago, and we didn't really know that. But nationwide data was saying that the Delta variant was out there, and the reason why I suspected that is that the patients who were coming in, say in May, June or so, were a lot sicker. They got infected. They came into the hospital within 2 or 3 days. Would require a lot more oxygen. Had a lot more, cloudiness on their chest X-ray or CAT scan, and required a lot more effort to try to turn them around. So the Delta variant is a nasty, nasty bug. So it makes it even more important to be vaccinated because of that. If you're asking Mr. Seymore whether the vaccines are still effective against the Delta variant, I believe they are, because the evidence is right in front of me every day in the ICU. Patients who haven't been vaccinated are the ones who are in there. I've seen, as I mentioned, about 3 Johnson Johnson vaccinated patients who ended up in the hospital, not very sick, but sick enough. I've seen only 2 Moderna vaccine failures, and one of them was a woman who was very, very immunocompromised. That's it. So the vaccine FDA approval, I think, is a good thing. It hopefully will tell people that it's not just emergency use authorization. There's enough data to support its safety claims. So yeah, I think that helps. That helps get people over the hump, hopefully.
You know, Eddie, you and I are probably old enough that we have a little scar on our arm from the shot that we had. Okay, and we had that shot back. Correct me, was that measles, polio?
I believe it was back when we were in grade school. Back
then, we had to have, and it would bubble up, and it was sore, and it would scab, and you could see people out there with their shirts that they had, those scars from that shot. But as that wore on, and as people, that disease was basically almost eliminated, from there. So some of these younger people never really had those type of shots that had that effect. So we aren't so far removed in our life that we haven't taken a vaccine that has kept us from some of those illnesses. I have had the opportunity of living with an aunt who suffered from that disease of polio. Other people in our community that we have had and would recognize that I've been friends with. And I look at it and I say, they're fortunate it was crippling disease and not maybe so much as a life and death situation, but we have advanced to where that this illness is a life and death situation for many people.
It is, yes.
And so as we're able to take precautions and take measures that will maybe save people, will maybe keep us from having to shelter in place, keep us from having our economies open, business open, and it's just a safer environment that if we choose to put safety first. And when we look at it as a city and as county and everything that we do, our largest dollars of our budgets are spent on public safety, whether it be our police force, whether it be our public safety, whether it be our hospitals, our nursing, our staffs, our immunizations that we do. Our number one concern is about safety. And so we are just where we put that as a top priority and we spend the taxpayer dollars towards those things. I think on a local level, we are really, I don't want to as an elected official say it, but I want to say it as personally, as a personal person, that I'm saying that I think this is a wise choice for people. If they will look at it, if they will study both sides of it, they've heard the negative, if they look into the positive and realize it. When I have 30 grandchildren and I have people that I go see, and I'm from state to state trying to see those because I don't have one of them that live in Show Low, I could become a very viral spreader. And so whatever I can do to know that myself and my family can be safe in those environments going forward, I want to be able to. And I don't want to, because there will be some states and some people will take different positions that will say you can't travel or you can't come here or you can't do this unless you are vaccinated. I don't like that, but I also want to be able to say, yes, I have been, and yes, I can come, and yes, I can do those things because I have shown an added measure of safety. And so with those things, that's why I've chosen to follow that path and to get vaccinated and encourage other people that it is a wise choice that will help others.
Very good. Yep.
I'm no medical expert, but I think the research and science has shown that it's effective. And now we have the booster coming up for most of us. And as soon as I'll just say, as soon as I'm eligible for the booster, I will get the booster shot too.
I think that's coming up around September 20th on some of them. And I believe our county does have ample supplies of vaccine available. I know that was one of the challenges we had early onset. We didn't have enough vaccine for people who wanted to be vaccinated. But share with us a little bit about the demographics, if you could. You don't know those exactly, but the people that are coming to the hospital are coming from local areas here versus areas that were more heavily vaccinated. Like we had our tribal areas were more heavily vaccinated than what our other rural communities were.
Yeah, that's so. There are the patients who are in the hospital right now coming to the emergency department. They're all local, within I would say a 30-mile radius of Summit Healthcare. We have not seen that many Native Americans in the hospital in the last 3 to 4 months, in contrast to a year ago. I think the vaccination effort, the contact tracing in the tribe, and the things that White River, for example, is doing with monoclonal antibodies for early disease has really changed the dynamic there. Right now, it's unvaccinated folks outside of tribal areas that are suffering in the hospital. And they're all unvaccinated, as I mentioned earlier.
And what effect does that have at the hospital for somebody who, say, has a heart attack or has some other illness that needs to be in the hospital?
And yes, that's the unintended consequence of someone not being vaccinated, getting infected, getting sick, and getting into the hospital, is that another person has a appendicitis or a heart attack, there aren't enough resources. There might not be enough resources in the hospital to take care of them expeditiously. That's the extended danger from having so many cases of COVID in the hospital and in the community. So if you're not going, my advice is, if you're not going to get vaccinated, then please at least do physical distancing and masking when you can't do physical distancing. At least observe some precautions. I mean, going out and eating and not being masked. No one likes masks. I mean, I've got my mask here. I wear a mask, 12 hours a day. A full N95 mask. I hate it. It's giving me acne. But the Delta variant now is very, very transmissible. It just takes a few breaths for one person to give it to another person. So if both those people are masked, assuming they're totally unvaccinated, both of them are unmasked, it's an easy infection to get. So just simple precautions. If you totally don't want to get the vaccine, fine, but please observe some precautions.
Comment?
I just thank Dr. Galhotra and the summit for taking care of the people we have in the hospital. And my comment is, get vaccinated, because it's going to save some resources at the hospital. It's going to, and for those of us that may need to have other procedures there, it's going to open up some avenues there.
Absolutely.
I think there's also a conception that the hospital has had all this big expansion and it's huge and we've got all these beds and everything there. That really isn't necessarily the case.
No.
So why don't you share with us just the beds and the capacity, how quickly we could become overwhelmed at our hospital?
So, it's not infinite capacity. The capacity is finite, and right now we've been running about at least 85% capacity, which is pretty high historically for Summit Healthcare, even with the expansion. The expansion has actually been mostly in the outpatient medical office building, not necessarily in the inpatient setting. Now, during the first wave, second wave, et cetera, we expanded intensive care unit beds, in which we've done again, but there's only so much room physically in the building. And more importantly, Ms. Seymore, it's the staff, right? You need nursing staff, you need respiratory therapists, yes, you need doctors, but the nurses are burning out, the respiratory therapists are burning out. They're finding that they can go to other areas like Louisiana or Texas and make, 4 or 5 times what they make here, in their regular job, and they're taking advantage of that. So there's a shortage of nurses. There's a shortage of all the staff that you need to take care of folks in the inpatient setting, not just doctors. So yes, those are the consequences, and we need to do whatever we can to reduce the load in the hospital.
I think it's great that we have our children, back in school. We're back in full session. Just share, I don't want to end without talking a little bit about children and the safety of vaccination for children 12 and older. If you just...
Well, the data is reasonably, is actually pretty positive for that age group. And so if, I have a daughter in Virginia who has a 7-year-old and a 5-year-old, and she's chomping at the bit to get them vaccinated whenever they can get it vaccinated. Truthfully, if the adults that are working in the school are fully vaccinated, it'll be a much safer environment for everybody. Because yes, children can get infected, but their disease usually is very, very mild. But the risk is that if a child is infected, he or she brings it home to the parents and the grandparents, or gives it to the teacher or the teacher's aide who's decided not to be vaccinated. That's the bigger danger, because those adults are vulnerable. The kids, for them, it's 99.999% of the time, it's just a little sniffle, a little sinusitis, just a little cold. But they can be carriers and transmit it to adults around them. That's really the bigger danger. And so therefore, the adults would be wise to get themselves vaccinated.
Great. That's great. Good advice, Doc. It's great to have you, share those insights with us today. One of the greatest things about this is it doesn't cost anybody anything.
Right.
All you have to do is go to a pharmacy. You can go to the county health department. You can go to almost any place around here. There's several locations. If you don't know where to go, feel free to call the city of Shoalo or the county health department, and we'll be able to schedule you or put you in the right direction of where you can make arrangements to have your vaccination. So, there have been many things that this community's overcome, and there have been many things, and sometimes the political environment is greater than it needs to be on this subject. And I just hope that we can do what we can to calm people. If you want to talk to us personally, we're available. We'll be able to share what we can share, but we just ask you to be safe and be cautious, and we'll get through this as we always have. It's my hope and my prayer that we will. The Lord knows us. He's protected us from fires. He sent us a water. He's done the things that we've asked. So we've asked for a vaccine. We've asked for some way to control this, and may we be able to be successful in doing so as well. With God, all things are possible. And with people who care, all things are possible.
Amen.
Thank you.
Thank you.
Thank you.
Appreciate it. Stay safe.